Good morning, everyone. This is Dr Ruchi, shirudkar, founder and director of Pediatreat. I'm so excited to do this after so long, and this time I'm going to do a remedy which is not very common. I have prescribed it 3 to 4 times, and why I'm discussing this remedy is because a lot of people kept asking me that how to study and how to evolve the remedy. So I'm going to share some remedies which are not very common, but to understand that how we study these remedies. So the remedy that I am going to discuss today is humanum. I have prescribed in 3 to 4 cases, not very frequently to be honest, but it's a very useful medicine and it works wonderful. So first I'll tell you a small case where I had given this remedy and has worked very nice. This was a lady, a girl rather, a 20-year-old girl and working in IT, and she had an issue of a lot of acne and amenorrhea, right? So when I asked her about the stress, she told me, yes, I have stress of my work. I said, what stress of work? So she told that, I'm very scared of my boss, and I always check and recheck my things that, I have done my work right or I have not done done my work right. So if there is 20 minutes work, I would take 40 minutes because I'll keep checking, because I have a fear कि कोई mistake तो नहीं हो गई, कोई गलती तो नहीं हो गई, and it takes a lot of time and I'm always worried about my work. So that was the case, and I had taken 3 important rubrics. Is fear authority of, that is she was scared of her boss. Second, fear mistakes of making. She was having fear कि कुछ गलती ना हो जाए मुझसे, कोई problem ना आ जाए, and anxiety business about, and I had prescribed her humanum 30 and she responded beautifully. All her anxiety about work and that checking and rechecking had gone completely. So when we study a remedy, we study an evolution from childhood to adulthood and in various phases. But when patients come to you, they don't show the exact evolution. They can come in a bracket, they can come in childhood or they can come in adulthood or adolescence or whatever. So we study a remedy. You should know the evolution and materia medica image, but you should also know the exact rubric, because you may, like in this case, there was no feeling or orphan or mother fixation, but still we prescribed humanum. So in cases, you should know the materia medica image and the rubrics also, especially the singular rubrics. They work wonderful. I have prescribed singular rubrics in so many cases of lately, but when it fits the core of the case, remember, the core of the case should fit into that singular rubric, then it works wonderful, right? So the remedy that we are discussing today is humanum. Any remedy that we discuss, we study from ailments, from that why that remedy is suffering. So humanum as a child is very energized and positive and confident, and sociability, company desire for, amusement desire for, euphoric feelings. So they are, that kind of children. But the problem starts from ailments from being neglected by a mother. Ailments from means there is an actual neglect. This is not a delusion of a person. So either the mother is not available, or mother is traveling because of work, or the mother is not able to take the due care of the child and is very busy in her work or family or joint family or anything. So when there is a neglect by mother, this kind of, it's a single neglected by mother being. So they developed a feeling of being orphan, of not being loved, of not being cared. कि मेरे को तो कोई प्यार नहीं करता. Forsaken feeling. Delusion alone, she is always, I am always alone, there's nobody for me, and the mother is not available. If you see the desires also of Lacan, you will come to know they desire warm milk, so they want that attachment from the mother, that love, caress, desire to be caressed, affection, desire for, so they want that love from the mother especially, and when they don't get, and they become very angry, they become very irritable. So anger interruption from, anger contradiction from, irritability mother towards, sadness mother thinking about when, so even an adult when talks in the history, when they talk about it, they would say, my mother was never available for me and she was a very busy lady and I felt very neglected and unloved and I always felt alone. And so I started making friends and I started seeing that love in friends. So they want friends, they want to be in the company of a friend. But if they don't get that kind of love and affection, which is their basic desire from friends also, then they are very hurt and very angry and they go in a different state. Delusion unwanted by friends he is, delusion friendless he is. So these are delusion, but how will the person say? I recently took a case, though I not prescribed like humanum, but she said कि मेरा कोई दोस्त ही नहीं है, मेरे दोस्त मुझसे बात करना ही नहीं चाहते, nobody wants to be with me, so she's friendless, उसके कोई दोस्त ही नहीं है, where she can really share her feelings and emotions. So delusion friendless he is. ये कॉमन भाषा जो पेशेंट आपका आके बोलता है, उसको जो रूब्रिक कन्वर्शन है ना, वही पूरा आर्ट है, राइट? सो अगर पेशेंट का जो वर्जन है उसको आप एग्जैक्ट रूब्रिक्स में कन्वर्ट कर पाते हैं तो आप 99% ऑफ योर वर्क इज डन. So they feel very hurt and irritable and angry. They feel betrayed, delusion betrayed he is, and unwanted by friends and friendless, and they go in a state of very anger and irritability, and they feel they are worthless, they have done something wrong, succeeds never. So I'm of no use. I'm not worthy enough. मेरे से कभी कुछ अच्छा नहीं होता है. मेरा कोई दोस्त नहीं है. पेरेंट्स को भी मेरी इतनी पड़ी नहीं है. हमेशा से I have been alone, and they go into a state of being very unfeeling, hard-hearted, indifference to everything, company aversion to, अकेले रहना चाहेंगे, and indifference to suffering of others. दूसरा बीमार है तो मुझे, पहले वो ऐसे नहीं रहते हैं. This is a later stage. So a person can come to any stage where they're wanting love or when they go into that indifferent stage. So you should know the totality of the remedy. So yeah, so they feel alone, they feel left out, they feel friendless, they feel not being loved and not being taken care of, and they go into a stage of indifference, okay, I don't care about anybody. Initially they'll be in love for friends and care for friends. Even if you see dreams of lac humanum, dreams is what? It's a reflection of your subconscious mind. So if you see all the dreams of lac humanum, you will see dreams of that they are with a friend, or they see the lake filled with mother's milk, or they see childbirth in their dreams. They see journeys with their friends, that she's on a journey with a friend, she's in a company of a friend, they see a childbirth, or they are with relatives and friends, because that is what they want. That is their desire, that I want love from family and relatives, and they would care for them a lot because they feel that it's their duty. They have a feeling of being orphan. So if you see orphan rubric, there are only 9 remedies. So what is orphan? Orphan is a child whose parents are dead, or the person feels that there is nobody for me. So they have a feeling of being an orphan, and they also have a care for people who are in a bad state, who are orphans, so they would do things for them. Right? So yeah, I will tell you some more dreams that they are. Dreams, mother milk asking for, naked alone being naked, reprimanded by mother's rude behavior. ये उनका dream है कि मम्मी मुझे डांट रही है, मम्मी is being very rude to me. Sick people, mother is. Reprimanded teacher or friend. There are 2 rubrics if you see in lac humanum, that there is a reverence, a lot of reverence for teacher, and the second rubric is impulse, morbid, suffocate teacher, desire to, which shows 2 sides of lac humanum. If you see Dr. Sankaran's view of lac humanum, he has talks about antagonism with himself, and 2 sides of will contradiction of what are 2 wills in lac antagonism in lac humanum is we saw it here also, the two sides, where he wants love, he wants caress, and then he goes into a stage of indifference. What Dr. Sankaran has talked of lac humanum is that they have a conflict. They have a conflict that they should work for self, or they should work for the society, or for higher, reasons in life. For example, as a doctor, I may feel that I should grow my practice, I should earn a lot of money if I have this conflict, or I should have a lot of patients, my practice should grow, or if I feel no, I should work for homeopathy and betterment of children, and I should let. So this is the conflict, whether you should work for your personal needs, or you should work for society or a group in large. For example, an IT professional has this conflict कि I should see my personal growth, or I should work for the company's growth. What is important? Dr. Sankaran called it as a communist living, where you are not concerned about your own gains and own profit, but you think about a larger community, a nation, a group, or something doing at a bigger level. So they have this conflict. There is one more conflict that we can use in our day-to-day practice is will contradiction of work and rest about. मैं आराम करूं या काम करूं? यार मुझे समझ नहीं आ रहा, काम बहुत पड़ा है. कुछ लोग होते हैं, जैसे नक्सवामिका है, उसको अगर रेस्ट करना होगा तो वो आराम से जाके लेट जाएगा. Disturbed hours to be made. Though he is workaholic, but when they are in disease, then they quite wants to be repose and tranquility, desire. अब मुझे कोई disturb मत करो. अब मेरे को शांति चाहिए, कोई आके मेरे को कुछ बोलेगा नहीं. दैट वुड बी नक्सवामिका. सीपिया को अगर बीमार है तो सीपिया इज इन अंडरटेकिंग थिंग्स अपोज टू हर इंटेंशन. जो लोग बीमारी में भी मेरा मन तो बहुत है आराम करने का, बट काम पड़ा है, बच्चे को खाना देना है, तो दे वुड डू द थिंग्स अपोज टू द इंटेंशन. मन में नहीं है फिर भी दे विल डू अपोज, मन के खिलाफ जाके दे वुड डू आउट ऑफ रिस्पॉन्सिबिलिटी, आउट ऑफ ड्यूटी. दैट इज सीपिया. और व्हाट इज लाक ह्यूमैनम? उनको ये द्वंद्व ही चलता रहता है, दुविधा ही चलती रहती है कि यार मैं रेस्ट करूं या काम करूं. विल कॉन्ट्रडिक्शन ऑफ वर्क एंड रेस्ट अबाउट. They have a lot of fear, fear of authority, of death, of alone, of disturbing someone. यार मैं दूसरे को disturb ना कर दूं, because it's a human milk, and life of embracing life, mistakes of making. I'm sorry, there's some disturbance outside my clinic today. Failure of examinations in. So they have a lot of fears. I've told you how, if you see all lac remedies, what are lac remedies? They are the milk. Lac leoninum hai, felinum hai, delphinum hai. Recently I was studying lac equinum, which is a horse's milk. So they will have a feeling of being mother या father या उनसे attachment के difficulties, and they will go into a state of worthlessness. Even lac can has. So what I'm going to do is I'm going to tell you each and every remedy gradually, once in 15 days. We'll study all the lac remedies. This will help you to increase your knowledge beyond those common remedies, and this will, I think, motivate you to study more. So how we evolve a picture is first study the singular rubrics of any remedy. For example, I must have prescribed it 3-4 times, but I don't know the full picture of the remedy. हम एक 5 rubrics लेके prescribe कर देते हैं. तो आप FN F5 सर्च में उस रेमेडी के सिंगुलर रूब्रिक्स निकालिए. फॉर एग्जाम्पल मैंने लाक ह्यूमैनम डाला एंड आई हैड टेकन आउट द सिंगुलर रूब्रिक्स ऑफ लाक ह्यूमैनम. सो डिल्यूजन फेसेस डिस्टॉर्टेड सीज, आई एम डिस्टॉर्टेड, unwanted by friends, friends don't want me. There's a rubric detached from ego. मतलब अगर कोई person इनको insult करता है या उनके साथ bad behave करता है, so they will not go into that anger and revengeful, and they're like ठीक है यार, मुझे पता है ना, I know what is right and wrong. I don't hold any grudge from them. So if this kind of a version a person is giving, they are detached from their ego. Clinging mother to, with indifference towards father. This is a complete repertory rubric. Mother को cling करना है, सारा problem mother से ही है. With indifference to father, father को नहीं problem, father के लिए. Sadness weaning while. Weaning क्या होता है? जब बच्चे को आप breast fed से धीरे धीरे you start giving them top feed, दाल का पानी, चावल का पानी. तो जैसे ही माँ उसको अपने से अलग करना शुरू करती है, the mother tries to go to the office or try to resume her work, they become sad, they become depressed. Sadness weaning while. This can be used in adults also. There was a company, आप एक boss who was nurturing you, आप उसके under थे, and now the boss wants you to take care of the group alone. Sadness weaning while. यार वो मेरा ध्यान रखता था, he was always there for me. अब he's slowly giving me all the. तो when you wean off something जिस पे आप पूरी तरह डिपेंडेंट हो, वो आपको मिल्क दे रहा है, आपका सब कुछ कर रहा है, बच्चा जो हेल्पलेस फीलिंग इन्फेंट लाइक. इन्फेंट क्या होता है? जब तक 1 साल तक हम एक बच्चे को इन्फेंट बोलते हैं. तो इन्फेंट इज अ पर्सन वेयर द चाइल्ड इज कंप्लीटली ऑन मदर. सो इसको हेल्पलेस लगता है इन्फेंट के लिए कि इसको चाहिए कि सब मम्मा करें. मदर फिक्सेशन में है this remedy. So you will find a lot of patients who talks about their mothers. There are some remedies like sacrum officinalis है जिसमें से delusion neglected by mother being है, ailments में नहीं है वो remedy. उसको भी caress चाहिए. Cuddle desire to be में single sacrum है. So study the remedies which comes closely to lac humanum and study all the lac remedies. What is their feeling? And then develop मटीरिया मेडिका इमेज भी और सिंगल रूब्रिक्स भी, क्योंकि बहुत सारे केसेस में यू विल नॉट सी द कंप्लीट पिक्चर, बट बिकॉज ऑफ दिस हेल्प ऑफ दिस सिंगल रूब्रिक्स यू विल बी एबल टू प्रिस्क्राइब लाइक ह्यूमैनिम सक्सेसफुली. लिमेंटिंग रिलेशनशिप्स अबाउट ह्यूमन. यार कुछ लोग ऐसे बोलते हैं लिमेंट क्या होता है? ऐसा रोना गाना, कि क्या यार ये ह्यूमन रिलेशनशिप्स बड़े अजीब हैं, इनको समझना बहुत मुश्किल है, दुख है इनमें, और क्या मिलता है आपको ह्यूमन. तो जो लोग ह्यूमन रिलेशनशिप्स पे लेमेंट कर रहे हैं, सिंगल लाइक ह्यूमैनिम. watched aversion to be, आप पूरी तरफ मेरी तरफ watched being aggravate, they don't like to be watched. आप जैसे छोटे बच्चे होते हैं, आप उनको हर समय देख रहे हो. कुछ बच्चों को चाहिए कि मम्मी रहें हमेशा, तो प्रोटेक्शन wants them कॉन्स्टेंटली, या दे वॉन्ट टू बी वॉच कि आप रहो, मैं खेल रहा हूँ लेकिन आप रहो, और ना आप मत रहो. तो वॉच्ड बीइंग अवर्जन टू या वॉच्ड बीइंग एग्रीवेट में लाइक ह्यूमैनिम है. दे हैव सैडनेस, सो यू विल सी दैट कॉन्फ्लिक्ट विद मदर, दैट neglected feeling from parents and especially mother in lac humanum. And sometimes you can prescribe without, as I discussed a case with you, right? Attached very strongly with mothers, mother fixation, mother complex, delusion always alone she is. तो वो गुस्सा करते हैं, anger towards mother, estranged from the family, anger towards relatives, indifference में चले जाते हैं, but it's a consensuous remedy. तो anger alternating with quick repentance maybe you would see lac humanum. Right, so quarrelsome family with. So this is a basic picture of lac humanum, which I had from last few times I'm not able to see the comments. I don't know why. If you have any query regarding any rubric of lac humanum, please put it down. Okay. So you have any queries? I'm just trying to see messages. So what is you are supposed to do is, आप सर्च विंडो में जाके आप सारा एक रेमेडी के सिंगल रूब्रिक्स पढ़िए. आपने एक बार सिंगल रूब्रिक्स पढ़ लिए तो आप उस रेमेडी के एलिमेंट्स फ्रॉम पढ़िए कि ये रेमेडी why this remedy suffers. जैसे इसमें है एलिमेंट्स फ्रॉम बीइंग नेग्लेक्ट बाय मदर. Okay. Yes, now I can see some rubrics. Sorry, some comments. यस यस. सो हाँ, फिर उसके एलिमेंट्स फ्रॉम पढ़िए, उसके डिल्यूजन पढ़िए कि पेशेंट का मेन फीलिंग किस में चला जाता है, वो फ्रेंडलेस में, अनवांटेड बाय फ्रेंड्स, वर्थलेस में चला जाता है. और फिर आप सोचिए कि ये जब पेशेंट आपके पास आएगा वो क्या बोलेगा, यू नो, ऑलवेज थिंक इट पैरेलली, क्योंकि आप रूब्रिक्स तो कितने भी आते हो, पर अगर आपको उसका नॉर्मल वर्जन पेशेंट क्या बोलता है ये नहीं आता, तो यू विल नॉट बी एबल टू कन्वर्ट. एंड ऑलवेज स्टडी द क्लोज रेमेडीज, द क्लोज कमिंग रूब्रिक्स विद दैट स्टेट. एक और बहुत इंपॉर्टेंट स्टेट है इस रेमेडी की, क्योंकि इसको लव चाहिए, करेज चाहिए, पल्साटिला, सैक्रम ऑफिशिनालिस. यू शुड, दीज रेमेडीज वुड कम वेरी क्लोज बिकॉज इनको भी लव चाहिए, कडलिंग चाहिए, करेज चाहिए. और ये रेमेडी क्या बोलती है, यार मर जाना अच्छा है अकेले रहने से, तो ऐसे जीने से तो मर जाऊं. किल्ड डिजायर टू बी रादर देन लेफ्ट अलोन. अकेले रहने से तो मर जाना अच्छा है, क्योंकि इसको माँ का प्यार चाहिए, इसको फ्रेंड्स का प्यार चाहिए, अफेक्शन चाहिए, करेज डिजायर में है, यू नो. सो yes, I am waiting for the questions regarding lac humanum. Any rubric, there's a rubric in lac humanum. Delusion nesting he is. What is nesting? तो आप एक एक रूब्रिक, कुछ रूब्रिक होते हैं जिनका कुछ भी मीनिंग आपको समझ नहीं आ रहा है, एंड दैट यू कैन नॉट यूज इट इन योर डे टू डे प्रैक्टिस, लीव इट. बट 90% ऑफ द रूब्रिक्स का यू विल अंडरस्टैंड द मीनिंग, यू नो. तो नेस्टिंग क्या होता है, जब एक बर्ड नेस्ट बनाती है तो वो शी इज प्रिपेयरिंग फॉर द बर्थ ऑफ द चाइल्ड, और ताकि वो चाइल्ड एक वार्मथ में, एक अच्छी जगह सेफली बॉर्न हो पाए, राइट. You will see lac humanum में love for children है, beget children desire for, वो बच्चे चाहते हैं और वो nesting में है. they will take care, बच्चे कोई भी हों, अपने आने वाले बच्चे हों या वो अपने पेरेंट्स को भी as बच्चे, क्योंकि वो आप पे डिपेंडेंट हो जाते हैं ओल्ड एज में, कि उनकी तरह समझ सकता है. Okay, I am able to see comments. You can write your questions now. Do you have any questions? तो या जैसे मैंने आपको बताया, सिंगल रूब्रिक पढ़िए, एलिमेंट्स फ्रॉम पढ़िए, यूट्यूब पे जाइए. बहुत सारे सीनियर्स ने, जैसे डॉक्टर राजन शंकरन का लैक ह्यूमैनम पे एक वीडियो है, वो ज़रूर देखिए. बहुत सारे टेलीग्राम, व्हाट्सएप पे ग्रुप्स हैं जहाँ पे हमारे सीनियर्स ने अलग अलग रेमेडीज़, मेरे भी सीनियर्स या मेरे जूनियर्स या वॉट एवर रेमेडीज डिस्कस की हैं. आप अलग अलग लोगों का परसेप्शन टूवर्ड्स दैट रेमेडी, वेयर दे हैव यूज्ड इट. यू कैन सी, आई रेड सम केसेस ऑल्सो विच आर पब्लिश्ड इन जर्नल्स अबाउट लैक ह्यूमैनम, कि उनकी मेन फीलिंग क्या होती है. सम फॉरेन ऑथर्स हैव ऑल्सो रिटन अबाउट दिस रेमेडी. सो you have to research, you have to, you know, puts in some efforts to develop that image of a drug, right? So I hope this motivates you to study more. That is the only objective here. I will try to put up saccharum officinalis and all the remedies. I've started studying lac equinum. I have also used that remedy in few cases, but with limited knowledge. So probably I'll try to do it in once in 2 weeks, though I promise every time, but it's just becoming difficult. And attend webinars of different doctors. You get a different perspective because each one has its own asset, you know, of practicing, and learn. That is the main objective. Yeah, so I hope that lac humanum is a little bit clear, and this would you know, be helpful to you. I also want to say something today. You know, I get a lot of messages that you have motivated us, and females talking that we want to go back to work because of you. And but if you get say 500 good comments, you are bound to get 2 or 3 bad comments also. And last time when I had done Staphylococcus aureus, so I saw 1 or 2 very nasty comments from one of the very senior physician, and he said something very very bad. And it's a human mind, we tend to, you know, go towards the negative feeling first. So in spite of 500 good comments, I was stuck to those 2 comments. And he was like, ऐसे यू नो नॉलेज नहीं होती है, और ऐसे ही लोग लिपस्टिक लगा के वीडियो बना लेते हैं. एंड आई वॉज वेरी हर्ट, यू नो. आई पुट अ लिपस्टिक और नॉट पुट अ लिपस्टिक डजंट डिफाइन माई नॉलेज, राइट? एंड देन दैट मेड मी थिंकिंग फॉर सम फ्यू डेज and don't motivate them. I would never do that. If even if a junior puts if anything about mother tincture or anything, I would always motivate because they are doing something right. And I came across a very nice quote, and I would like to end my this Facebook live with that quote. निंदा से डर के अपना लक्ष्य ना बदलिए, क्योंकि लक्ष्य मिलने पर निंदा करने वालों की राय बदल जाती है. तो जो लोग आपको इतना क्रिटिकल हो रहे हैं या आपको लुक डाउन कर रहे हैं, डोंट लूज योर एम और लूज योर फोकस, बिकॉज the moment you achieve that, people who talk very bad about you change their opinion. So no matter how many people around you are telling that, oh, you are earning only 500 rupees, or oh, 10-15 हज़ार कमाती उतना तो भाइयों को दे देते हैं, I've heard it all, and I know people hear that, and people who are saying also, I would not say wrong about them, but I really want you to put all these comments down and study hard and try to achieve something in life which you are worthy of, right? So that is my biggest aim now. पहला एम तो ये है ही कि बच्चों को हम ओवर ड्रगिंग और बहुत सारी एलोपैथी ना दें, और दूसरा तो विच आई फील वेरी स्ट्रांगली अबाउट इज I want every woman homeopath, a female homeopath, should work and not worry about all those nasty comments and criticism that comes their way. So thank you all of you. I hope we continue this learning path, and I hope we study a lot more remedies and conduct a lot more webinars. So it's been absolutely great and heartwarming and touching with all the love that I have got in such a short span of time. I feel extremely, extremely blessed with all this love. Thank you.